Hi, and welcome to Lambda U. My name is Jessica, and I'm a Solutions and Support Scientist at LICOR. Andy just gave us an excellent overview of the science behind the primary antibodies, and now we're going to discuss the best practices for your primary antibody step. As a reminder, blocking the membrane prevents the primary and secondary antibody from non-specifically binding to the membrane and other non-target proteins. Without this step, the primary and secondary antibody would bind to the membrane and increase your background. Now, once the membrane is blocked, it's ready to be probed with a primary antibody. So you don't want to wash your membrane between the blocking step and the incubation with a primary antibody. This wash would remove the blocking agent from the membrane, which would lead to an increase in your background. One of the most important factors in the success of your Western blot is the primary antibody. Thorough testing of the primary antibody is critical for obtaining the highest quality Western blots. To learn more about testing and validating your primary antibody, refer to the Lambda U course on antibody validation. You want to ensure the specificity, selectivity, and reproducibility of each primary antibody. Optimize the conditions for your primary antibody that are best for your experiment with your samples and using your experimental protocols. As part of the antibody validation process, you will first have to determine the best incubation conditions. There are a couple different options that you can choose from. You can either incubate the primary antibody for 1 hour to 4 hours at room temperature or overnight at 4 degrees Celsius. But once you determine the ideal conditions for your primary antibody, you want to make sure that you use those same conditions every time. You don't want to incubate your membrane for 1 hour at room temperature one time and then overnight the next time. Inconsistency in these incubation conditions will lead to variability in your Western blot and decrease the reproducibility of your data. So, about that time frame overnight, oftentimes ambiguity arises when a protocol calls for an overnight incubation. If you're incubating your membrane in the primary antibody solution overnight, you should really define what that time will be. To some, an overnight incubation can mean any time from 12 to 20 hours, but it most commonly means 16 hours. So once you choose the time for your overnight incubation, make sure to use that same time for every membrane. If you choose to incubate your membrane overnight, this will typically lead to a higher signal for your target because the primary antibody now has more time to find your target protein. However, you may also see higher background in your membrane because your primary antibody has more opportunity to bind to the membrane. So you don't want to incubate your primary antibody for any longer than overnight at 4 degrees Celsius. So now that we've covered the importance of choosing a good primary antibody and the conditions for probing your membrane, next we'll cover the best practices for preparing your primary antibody solution.